Hello, all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today's topic is, should doctors do MBA or not if they really want to become entrepreneurs and make their own startups? Okay, so whether you should make a startup or not, even that I will tell you in this particular video, and why you should do it I will tell you. Because if you are not doing, someone else is doing and making billions of rupees or dollars, so why not you start it? Okay, so that is the agenda behind this particular video. So should you do an MBA or not for that? So at the end of the video I'll tell the answer. First let me explain what kind of businesses a doctor can start if he really is planning to start entrepreneurship journey in India. So there are 6 kinds of businesses in India, you can see on the screen. So number 1 is hospital. That is the only thing we all know. Hospital, set up a hospital and then admit patients and treat. So it can be done in different levels. Corporate hospital setting up in individual level is very tough. So usually people set up hospitals around 50 to 100 beds, or a group of hospitals come together and 100 to 150 beds I have seen. So if you are setting up, then in cities it is getting tougher because corporates are actually expanding to nook and corner in cities. So it is better to go for tier 2 and tier 3 cities if you are really planning to go for hospitals. That's a separate topic. So next, pharma companies. So can doctors in individual level to set up a pharma company would be very difficult. Somebody was asking in the comment, it's very tough, lot of regulations would be there, and also it needs a lot of capital. It would be very risky. Diagnostic companies, yes, you can start chain of diagnostic companies, and Thyrocare, and it is established by a scientist called Ratnavel sir, and I've seen his interviews. They're very inspiring interviews and podcasts he does. So if you want to be an entrepreneur, watch his interviews. And so a Thyrocare set of diagnostic centers like that, like a franchise model you can develop, and many doctors are doing it and many engineers are also into that. I know many engineers actually have a chain of diagnostic centers also. They're making good amount of profit there. Medical equipment and supplies also, many people you can actually start, and you can actually supply the medicines, equipments to different hospitals, and also you can rent equipments. For example, like in intensive care I usually see DVD pumps and so many other things. They are rented by certain companies to hospitals. Most of the hospitals now, corporates, how they come up is they don't buy actually all the equipments, so they rent from certain companies. You can actually make a deal with the hospital and then you can rent certain equipments to them, and you will be doing the AMC and servicing to that, and you will be getting some kind of profit margin. This is another way of doing business. Medical insurance is another area, but in individual level you cannot start it because a lot of big players are there, like all the major banks are into that, so that is a difficult area to enter. Okay, the last is telemedicine. Telemedicine is where most of the startups are coming. Let's go into the telemedicine area now, and this is my personal favorite also. Okay, so healthcare sector in India is rapidly growing. If you see in the last 10 years, it is growing leaps and bounds. Now in 2022 is 372 billion US dollars, not rupees, US dollars. That is the capacity of Indian healthcare now, and the projected is 1 trillion US dollars will be the healthcare economy in future, in 5 to 10 years down the line. That is why a lot of foreign companies are coming into India to invest, so because they are looking at a lot of growth potential in India. These are all the foreign investors who are investing in India. Manipal hospitals, right? So they get investors from Temasek, and Max Healthcare has investors from IFC. Paras investors are Creador Capital. So basically all these big international investors are coming into India and they're investing in Indian healthcare sector. They are not fools, right? They are investing because they are looking at a very good potential for growth in India. That is why they're coming here. So now you need to understand whether to stay in India or go abroad, because I feel when everyone is coming and investing in India, I think I can see a very good potential in Indian healthcare in future. I think you should stay in India rather than going abroad. And if you're looking at a longer perspective, if you want cash immediately, then you go to some other country and make money. And coming to the statistics, at present in India there are around 1.3 beds for every 1,000 patients, but the target for 2025 is 3 beds, and that's the WHO standard is not there, but that is the target India would reach, okay, to give a quality service to the patient, and we might require another 3 million extra beds. So there is a scope for all different kinds of players there, because the even corporate hospitals can add only 10,000 or 15,000 beds. in each corporate in next coming 5 to 7 years down the line. But so 3 million touching is very tough. So many different players actually in individual level also. You can start your own hospitals and add more beds to this 3 million. You will get patients, don't worry, if you give quality service. And if you give quality service to the patient actually will go and get more patients to you. That is how it will run. Okay, for that you need good skilled doctors and skilled nurses working in your center. That is the most important thing. And the next thing is physicians at present in India 0.65 to 0.7 up to 0.8 for every 1,000 population, and WHO standard is 1, and to reach that we need another, according to statistics, 1.5 million doctors are required. But I don't think that many number is required, because some element of saturation might happen in our country. That is because 1 lakh doctors are being produced, but there is a requirement also at the same time. So what is happening is there is an uneven distribution of doctors happening. Like some specialties will get saturated, some might not get, and those are the videos I'm trying to do. So some of you are commenting, I can understand that these statistics are not required and all that. So why I do is, so you need to understand which areas are actually bulkily densely populated with doctors. Those areas it doesn't make sense to enter. That is what I'm trying to do. And some areas where people are less, it makes sense to enter those areas. Okay, that is about the numbers. So let us come back to this telemedicine area. So telemedicine is having a very good potential. I know some of the companies actually they are managing ICUs distantly from another location, and they are actually charging per bed from the hospitals, and they are making good profits now. Initially they were running in loss, but they are making good profit now, and that is one way of doing telemedicine. And there are other telemedicine apps like before going into the individual apps, I would like to tell you there are 8,000 healthcare startups in India. Okay, in that almost valued at $2 billion US dollars is the valuation of that, and most of the healthcare startups are going at a percentage of 40% profit they are making, growing at a rate of 40%. Okay, so this is the number of healthcare startups in India. In that 8,000 healthcare startups, how many are owned by doctors? If you ask me, hardly any. Most of them are owned by engineers and MBA guys. So these are the top healthcare startups in India at present. PharmEasy is having funding. So when you try to assess the the success of a startup, it is mainly assessed based on the profits. That is secondary, because most of the startups usually don't make profits directly. So investors would see the potential in the startup and they'll invest their money, because profit will usually come 3 to 5 years down the line, but investors usually will put in some funding, right? So most of the times if investors are putting in money, that means it is a good company. So a company which has billions of dollars of funding is usually considered successful, and the founders usually make a lot of money there. So PharmEasy is one such startup where they received a funding of 1.7 billion, and CureFit is another startup. We got 674 million US dollars, and Medibuddy and Pristine Care. So PharmEasy and CureFit are more like drug delivery, but Medibuddy and Pristine are a different concept. What they do is, through these applications actually you can get a surgery also done, you can get diagnostic tests done. So it's like a destination, you can get anything done there. So they eased the work of a patient. You just enter the website and then you do whatever you want. That is what they are doing. I don't have any kind of a conflict of interest with them. For the sake of presentation I'm showing. Okay, I don't have any contact with them. So Medibuddy owner, actually Medibuddy, this is a Medibuddy app. So for example, you have recent cataract problem, then you can go there, click on cataract. It's so simple, right? They'll show all the centers, you can choose the doctors there. So you can get any surgery done. So they will only come, they will take you in their cab to the hospital, they'll get the operation done. Yeah, it seems in Pristine Care, I've seen this podcast recently, they even supplies food for the relatives and everyone, which hospitals doesn't do. Hospitals give food only for the patient. So in Pristine Care, it seems they'll give food even for the patient relatives. That's a good thing actually. It's all about service, right? How you need to give excellent service to the patients, and they will refer more patients to you. 100 times I'm telling this in all my videos. Focus on patient's experience. For that you have to put a lot of effort. Okay, it's not only about giving medicines to patient or injecting or putting some IV line. It's an overall experience, okay, that you need to create for the patients. At the same time, one more important thing I would like to tell, if you decide a treatment, then just because you have to give some experience to the patient, don't try to compromise with the treatment. The treatment that you decide with logic should be given. You have to explain to them and convince them, and then you have to get the treatment done, because they don't understand it. And when you're doing that, you give them a good experience. You have to finally balance that. Okay, so he is the founder of Medibuddy, is Satish Kannan, and then he is not a doctor. Okay, he's not a doctor, he's an engineer from IIT, and then he made this. He's come in Forbes 30 under 30, and he would be having a lot of money with him. Okay, he's the founder, right? So why I have shown his profile is, why not a doctor in his place? Why engineer only should do this? So you might be saying that, no, we don't know software and all that. He doesn't know healthcare here. He read about it. He's an inspiring story actually. He read about healthcare. He will not be knowing what a brain tumor is. He wouldn't be knowing what an hernia is. He would have read everything. He would have done his research. He would have appointed a team of people. He would have appointed doctors to work for him. They would have developed software and everything. His strength is software, so he would have built on the software side. If you are in his place, your strength is medicine, right? So you don't have to read that. You will read more about software. You will appoint engineers, and then you will get the work done. In that way you have to think. Okay, nobody will know everything. Many people will be like, I don't know about that, I don't know about this is not the right time, actually my marriage is there, my kids are there, so all those factors will be there for everyone. If you think like that, you cannot do anything. There is no right time for doing. In whatever time is there, you have to start, you have to take that risk, and then your photo also will come like this, 30 under 30, or maybe if you are cross 30, then 40 under 40 you can target. Okay. So then what is the pathway, if you ask me? So pathway I'll tell you now. So first, this I told in my previous video also, but people who have not watched that video, this is the way. First, with your MBBS knowledge, you try to understand where problems are existing. Satish Kannan will not know where problems are there. He would have inquired the doctors. That is the biggest thing he has done, identified the problem, and then he actually solved it. So for you, actually, you know the problems. You will be with the patients, ask them what is the problem, or they will only tell you. It's very easy for you to know. So understand where the problem is, where patients are actually having issue, and what Satish Kannan solved is, for a person who doesn't have medical knowledge, who's an immigrant, for example. I came to Bangalore. I don't know who a good doctor is. So what by going to Medibuddy, he will actually help me in getting a surgery done. That's what I want, right? So rather than going to some doctor who doesn't have experience, they will actually do the research, get best doctors for me. That is a problem he solved. So in the same way, you try to identify the problems and solve them, and then you have to present that to venture capitalists. I'll tell you then how to do that. So problems you have to identify, and sometimes you can take the feedback from senior doctors. They can tell you actually what can be done, even though they don't know how to do it. They'll tell you where problems are there in the industry. Even first start with a small problem. You don't have to solve the biggest problem in the world. Take a small area and solve that. Go into niche area and solve it, and then make some kind of a profit. It should be a starting point in a startup. Don't think of making a startup which will click in the first. The first startup should be for you to understand the business. Okay. And then, for example, healthcare. So Medibuddy has made an app which connects patients, and patients will go there, they'll find doctors. Okay, in the same way, you can also make something called as a healthcare market app with the help of artificial intelligence. So where people enter their data, artificial intelligence will collect that, refine the information, and then it should have access to the database of doctors. It will sync both of them. Something like that, everything with AI, so that in Medibuddy they might be having a bigger team. Maybe in your application you can actually cut down the number of people required. You can use artificial intelligence to do the same thing. You can compete with those companies also with lesser margin, and people will invest, because if you tell them that I will do Medibuddy kind of business, but this is AI I'm using, so my operating costs are lesser, and I can give a better connection between patients and doctors. Something like that. If you can convince venture capitalists, then they will put their money, and they will actually put this one. Your risk is not there. It is their money. Your share will be there since you're operating it. Even if you're losing everything, everyone would lose the money, and you lose some time. That's it. But in the process, you will actually learn how to do business. So then, whether to do an MBA or not, I will tell you now. Answer would be very funny. Say for example, you're seeing a farmer there. A farmer is there. How does a farmer learn farming? Answer is by farming. So you have to get into the mud, and then along with some people, or start sowing some seeds, and then rains will fall, how many crops will come. Getting into the field, you learn. In the same way, business also is like that. For learning business, if you start a small business, and either online or offline and related to your area, if you run one project, whether it's a click or flop, start with a small income where you can take the hit of the losses, and then in the process you learn the business. That is a better way of real-time learning how to do business than actually doing off an MBA for 3 years. So these MBAs and all these things are more like these bigger organizations would be actually charging you humongous fees, so they make profit. That is their business model. So you actually think that if I do MBA, everything is sorted, I can start my own. It is not like that. It is more like you have to have your things right, and mindset right. You have to start something, get into the field, run one business. If you're lucky, it will become profitable. If you're not lucky, at least you'll learn business. In the process, you will make a plan for the next one that will become click. Okay, that is I think you need to do. It's not about doing MBA or not. It's about doing some business and then learning in the process. That is more important. Okay. So then, okay, Dheeraj, now I got convinced. So I don't want to do MBA. I want to start. Where to start with? So where to start is, since you're a doctor, so where to start is, first start with a niche area. Okay. So some people claim that broader markets are fine because you can reach worldwide. That is a good thing. You can make more money, I can understand. But the problem is, my advice is to niche down. So because if you target one niche of area, for example, one app which I really want to develop is discharge summary. That is for doctors. So doctors, as a doctor, when I make discharge summary, I usually waste 15 to 20 minutes. So which I really don't want to do. I want to focus that time also on my patients. I want to treat them. I want to talk to them and do all that. But because of the discharge summary, I waste a lot of time. And I have to do it perfectly. Okay, I have to give all good data to them, discharge advisors and all the investigations which I did, I need to incorporate there, do all that. If I build an AI app, if it does all these things, because it doesn't require much intelligence, right? AI can do that. And I'll just modify that. So niche area I'm targeting, only discharge medications, discharge summary making for doctors only. So the chances of it clicking is more than me starting some business for all the diabetics in the world. Okay, it looks like $1 billion business, but it won't click. Okay, because it's more like shooting your gun in all the directions. Better to be a sniper and shoot exactly on one location. That is my advice. Okay, but the problem in this kind of way is the profit margins, the scope for the growth of company would be low. Because see, for example, if really the diabetes kind of app clicks, billions of dollars you can make. But in these kind of small niche areas, the chance of success is high. At the same time, your profits also, there's a ceiling for that. You can't make hundreds and hundreds of billions here. You can make some amount of money here. That is the downside. But in this process, you learn how to actually run it. And in the process, you develop contacts, you develop wisdom, and then you can plan your next project in a broader areas. To start with, I'm telling, these niche areas are better. Okay, and then funding is important. Don't put your money into it. You go for investors and then explain your concept to them, and then show them your team. Make a team of people. So I'm making a team of doctors now, and 5 doctors I have selected. Nearly 15 to 20 people applied. Thank you guys for showing interest in my discharge summary application. So five people I already selected. Many people are applying. I'm making a list of all you guys. I will involve you in my next project surely. So okay. So you make a team, and in the team, mainly I am forming a team of doctors only, because I want, it's an entrepreneur revolution for doctors is what I am starting. So I want doctors to become entrepreneurs. So that's why I'm involving doctors. If required, we'll take 1 or 2 engineers and finance guys later on in the process. So you need to have this kind of a team and a USP, and then a niche area, then chance of clicking are more. It's not that 100% success is there, but the chance of success will increase. So I think you guys understood now whether to do MBA or not, or the answer is, it's not about doing MBA or not, it's about doing a business. And my advice is to link AI to that. For that, some kind of AI courses you try to do, or there are in YouTube also a lot of videos are there, but doing a formal course actually gives you a certificate, and structurally they're explaining, because I'm also seeing. If you want some links, I'll keep in this description. You can go through those courses. If you really like, you can do. So that is the thing. And Hope this video motivates some of you to start your own startups. I want to see you guys like Satish Kanan there, okay, not some engineer or finance guy. I want doctors to be in that position and create more jobs for other people, because lakhs and lakhs of people are passing out. If everyone wants to come into health sector, it will be a competition. So some should become entrepreneurs. Like one application of AI, if I make this research summary app and if it clicks, if I make a lot of money, another 100 doctors I can give jobs in my company. So you actually create employment there. That is how you need to do. So entrepreneurs will solve problems, at the same time you create employment. So right now for India, doctors and entrepreneurs, the entrepreneur revolution is very important. That is why I did this video. Okay, so not to offend anybody and not to offend any finance guys or not to offend any kind of engineers. This is done with a good intention to create more doctors, because when doctors enter the healthcare business, the thinking will be different. The thinking will change. The way they go into deep and get the logics out would be totally different. Okay, so I want experienced doctors to enter, not when at very junior level. I want junior doctors to gain some experience or join the team of experienced doctors, and experienced doctors, if they enter, that will change the game of entrepreneurship in India. Okay, I hope you guys like this video. If you like, then share the video to the young doctors or senior doctors, anybody who really wants to do the startup. And if you want to connect with me in my LinkedIn, Dheeraj Masapu, type in LinkedIn, it will open. You can message me. If you really have a startup plan, we can discuss. If you have a problem, we can solve together. And my first team I selected. If you really have some kind of an idea and plan, we can form another team, and we can actually, our subscribers only, we can take in our teams and start another model in future. So let me also learn how to do it, and then more and more startups we can make in future. So thank you guys. Thank you for following the video till now, and let's join the Billionaires Club.